California was the first state to enact a stay-at-home measure, and this early move has been praised for heading off a surge of the deadly virus. But the state has lagged in testing. With nearly 40 million residents, the Golden State has tested a smaller share of its population than almost any other state. Competition for scarce testing kits and personal protective equipment has hindered testing. As supplies become available, California Governor Gavin Newsom aims to quickly ramp up testing.
We are well on our way to meeting our 25,000 testing goal and getting to 60 to 80,000 very shortly thereafter.
Healthcare experts agree that reopening safely requires the kind of data that only widespread virus testing can provide. Public and private healthcare providers around the state are rapidly mobilizing. Kaiser Permanente is bringing this large testing facility online in record time.
We're actually opening up a 7,000 square foot lab that we stood up in like 4.5 to 5 weeks. It's like light speed. And we'll have the capacity to run about 10,000 tests a day.
But rolling out testing on a large scale has been hampered by the smallest things.
Believe it or not, one of the things that's in short supply are swabs to do the tests. And so we're in the process of actually working with a domestic manufacturer who can 3D print the swabs so that we can ramp up testing.
So far, most testing is focused on people with symptoms and those in contact with them, using a sample taken from the nose or throat. But there are also blood antibody tests that can tell if a person has been exposed to the virus without showing symptoms, information that may be critical for reopening society.
One of the big questions out there is, can we safely open things back up and not have big flare-ups of the disease? So that's where the population-based testing is going to become more readily important.
In a first for the United States, every resident of this rural town, Bolinas, California, was offered free COVID-19 testing administered by researchers from the University of California, San Francisco.
We wanted to understand what is the viral footprint in a community such as ours, and use that information to understand better community-wide spread.
Both swab tests and the blood antibody tests were administered to more than 1,800 people, nearly everyone in town, giving researchers a baseline with which to track the virus.
We're going to need to get to a place where we can do repeat testing. We know that on that day that person got tested in Bolinas, they were negative. We don't know a day later. It's a window in time.
Many of California's new testing sites are in high-risk urban areas, as well as rural areas, with limited access to health care. Still, officials acknowledge there's a long way to go. For VOA News, Matt Dibble, Oakland, California.